Hi, my name is Terry Kuti. I am the founder and director of Deep Sea Foundation. We are actually reporting live today. We will be repurposing this video for educational purposes for those affected by breast cancer who are seeking all options for breast reconstruction. And I'm with Dr. Zeev Peled, who is a microsurgically trained, board certified surgeon. And yesterday I went to one of his sessions on nerve preservation. And I've asked Dr. Peled to do a wrap up today of his session to talk to us about what he shared and the importance of knowing about nerve preservation in breast surgery and breast reconstruction. So, Dr. Peled, thanks for joining me today.
Thanks for having me, Terry. Really
Yeah.
appreciate it. Yeah, I think breast sensation and chest wall sensation, really
Mm-hmm.
following mastectomy, with or without reconstruction, is I think a fairly unappreciated issue. I think a lot of women aren't spoken to, and men for that matter as well, about the significant risk of loss of sensation after a mastectomy procedure, whether it's for cancer prevention, such as a patient who has a genetic mutation, or whether it's for treatment of cancer itself.
Mm-hmm.
Most women have little to no sensation throughout their entire breast area, and often little to no sensation in the nipple areolar complex afterwards. And that has been the case for many, many years. But with newer reconstruction techniques for nerves and the ability to understand how the nerves run through the various portions of the breast and the chest wall, there are several options available for patients to really optimize sensation post op. So, after 600 plus mastectomies that we've done in this way, and papers that we will hopefully continue to publish, we find that in about 25% of patients, the nerves that ultimately reach the breast skin and central breast mound, which includes the nipple areolar complex,
Mm-hmm.
actually pass outside the breast tissue. And with careful dissection and identification, which oftentimes is not done in traditional approaches, these nerves can actually be preserved. So that's an actual nerve preservation. And the idea is that there's no nerve repair or reconstruction. So as soon as that nerve wakes up again, for lack of a better way of saying, which does take a couple of weeks or a few months in most cases,
Right.
sensation really is normal to near normal.
Mm-hmm.
Now, that's about 25% of the patients that we operate on using this technique. The other 75%, the nerves to the central breast mound and sometimes skin actually pass through the breast tissue. And at some point, when you take the breast out,
Mm-hmm.
some portion of that nerve has to be taken with it. However, as with any issue with regard to nerves where a piece of nerve is missing, so for example, if you had a sharp cut to the forearm and an important nerve that controls the hand was cut or maybe injured such that a piece of it had to be removed,
Mm-hmm.
for example, with a nerve tumor, that nerve would be reconstructed. And we are now able to reconstruct those nerves during the mastectomy procedure so that, again, within a few weeks or a few months, sensation comes back. And the wonderful thing from our patient population so far is that it seems that by 6 to 12 months following surgery, over 80% of patients are reporting good to excellent sensation in all the breast areas that we're testing.
Mm-hmm.
And many of those patients are then saying on the surveys that they fill out that their breasts continue to play an important role for them in intimacy after surgery, which is really a big change from some of the literature that has been produced to date before we started talking about this technique.
Yes, and we always, I think, the erogenous sensation to the breast is a topic that is frequently talked about because it
Mhm.
is the breast. However, Dr. Pella, there's also, the safety mechanism as well. Do you want to speak to that a little bit?
Yeah, that's a great point, Terry. So I think, first of all, protective sensation
Mm-hmm.
is important because there are multiple reports of women having thermal burns or,
Right.
for example, wearing a new sports bra which rubs, but they cannot feel it.
Mm-hmm.
And then, of course, if you end up with a wound and you have an implant underneath and that implant becomes exposed, that implant needs to be removed,
Mm-hmm.
and that's another operation. And then you probably don't have any sort of prosthetic in place to reconstruct that breast. And then if you want to reconstruct it, that's yet another 1 or 2 operations. So you're absolutely right. Protective sensation is important in that it can have a potentially devastating effect on the underlying reconstruction.
Yes.
The other thing to keep in mind is that when a sensory nerve is injured, that's a
Mm-hmm.
nerve that provides sensation as opposed to moves a muscle.
Mm-hmm.
Uh, the lack of sensation or numbness is not the only problem.
Mm-hmm.
And in fact, the incidence of what's called post-mastectomy pain syndrome,
Yeah.
which is some uh, kind of chronic pain post mastectomy, is anywhere from 20 to 70% in several very large studies. Now, that range is likely a function of the fact that we don't have a very consistent definition of what constitutes post mastectomy pain
Yes.
throughout the literature. However, I think it's very fair to assume that a significant number of those patients have neuropathic pain, which means pain directly secondary to those injured nerves.
Mm-hmm.
And one of the most remarkable outcomes from all the work that we've done thus far is that at this point, we have yet to see a patient back in the office after over 600 mastectomies
Mm-hmm.
with any sort of dysesthesia, which means altered sensation that's painful or uncomfortable
Mm-hmm.
beyond 6 months.
That's
And
good news.
yeah, and I think that's a function of the fact that if you assume this pain is caused in large part by an injured nerve, we know from work throughout the rest of the body that for injured nerves, the uh, best treatment is often to find them, to
Yeah.
remove the injured portion of the nerve, and to give that nerve something to do, which we do prophylactically, essentially, at the time of the mastectomy. So
Yeah.
a lot of real benefits from this approach.
Yeah. You know what I liked in a lot of the comments that were made in your session yesterday is the word call to action.
Mm-hmm.
And one of the things that I like, you talk about, you have referred to the pronoun we, and I know you're talking about
Yes.
your fantastic partner
Mm-hmm.
and your wife, Dr. Ann Peled, who
Yeah.
has worked side by side with you on this.
Yeah.
But I love the comment that you guys consistently make. So the call to action, I think, for surgeons would be to add this to your armamentarium because, like you said, once you see a nerve or find one, how do you say that again?
Yeah. Once you see a nerve, I like to say you can't unsee it.
You can't unsee it,
Yeah.
yes. And so for me personally, the call to action for patients, if I might take the opportunity to say so in the video, is to ask about nerve preservation. Optimally, this is what we want to do at the time of mastectomy. We know we have to, it has to be oncologically safe. It has
Mm-hmm.
to be in the hands of an extremely skilled surgeon, but it can be done and patients need to ask about it.
Yeah, I think that's the
Mhm.
real take-home message and bottom line. I think
Right.
patients understanding that this is an option is
Mhm.
critical. I think it also drives surgeons to learn about this technique.
Yes.
And there are many surgeons who, hear our presentations and those of others who do this work and are, that is their call to action to sort of take on and learn a new way of performing a mastectomy.
Yeah.
But I think it's also driven in large part by patients. And the more we have that kind of double pronged approach,
Yeah.
the more this will kind of be at the forefront of the zeitgeist and will be available to more women, which really is the bottom line.
I like the double pronged approach.
Yeah.
Thanks for being part of it today.
Thank you for having me and talking to me.
Yes, absolutely. Thank you so much. And please let us know if you have any questions or comments, and we will try to get to those. Thanks so much.